Module 1, Objective 2, differentiate anatomical landmarks from anatomical regions and be able to identify abdominal pelvic quadrants and regions. When we consider surface anatomy, this is when we locate structures that are on or near the surface of the body. And surface anatomy can be examined through a number of anatomical landmarks. And there's a lot of components to this that we're going to cover. Let's start with proper anatomical position. This is a position at which the individual has their hands at their sides, and their palms and their toes and their face are all facing forward. From anatomical position, we can consider two positions in which an individual is actually lying down. If they're lying down face up, that's referred to as supine. And if they're lying down face down, this is referred to as prone. I always remember supine is on your spine regarding lying down on your back, so you're face up. Anatomical regions are universal terms that are used to describe anatomical parts. So for instance, if you look over this figure, you might recognize things like nasal, and nasal refers to the nose. One that I often pinpoint in this part of the lecture is the mental. Mental refers to the chin region. And if we were to go anywhere in the United States and refer to the chin, I think everybody would know what we were talking about. But mental is universal. You can go anywhere. So what I'd like you to do is start working on this terminology. And just a bit of a warning, this terminology from this figure, and you can see that this figure has multiple parts. This terminology will be on nearly every single exam that you take, so please do take some time and learn this now. It's also going to help you later on as we start to study different organ systems. So we have brachial nerves and we have axillary arteries. They're going to come up time and time again, so getting them down early makes a great foundation for the rest of the semester. So I'm not going to spend any time going over this, but I do need you to work on memorizing all of this terminology. And these are referred to again as anatomical regions. So on an exam, I may ask, what is an anatomical region? And that's what I'm referring to, all these terms. We can also divide the body into various parts. And if we consider the abdominal pelvic region, we have quadrants as well as regions. There are 4 abdominal pelvic regions. You can see that there are 2 lines that are perpendicular right here at the umbilicus, or the belly button. And they are simply left upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. You would think that this would be very easy, but you have to get your left versus right correct. And what I always tell students is left and right when it comes to healthcare is always with respect to the patient. So it's the patient's left and the patient's right. Sometimes if you're facing a patient, it's very easy to use your own left and right, which would be opposite, but it's always with respect to the patient. We can take these abdominal pelvic quadrants and further subdivide them into abdominal pelvic regions. And you can see here there are 9 regions. The right hypochondriac region. Hypo means below. Chondro refers to cartilage. So it's looking at the area below the cartilage that we have in our rib cage. Right lumbar region. Lumbar is lower back. The right inguinal region. Here's your inguinal region right here, so that is the right. And we have left correspondings. And then here in the middle we have the epigastric. Epi means above or on top of, gastric, the stomach. We have the umbilical region for the belly button area, and then we have the hypogastric, where hypo means below, so below the stomach. In terms of these abdominal pelvic quadrants and regions, I would tend to use a figure like this to assess your understanding. So on exam, I might pinpoint the appendix and ask you what quadrant or what abdominal pelvic region this particular organ is in. I could easily pick the spleen or the liver. Any of these organs would work within the abdominal pelvic cavity. But this is how I would test your knowledge of this. Just remember that the belly button is right here at the center. Other terminologies that we use frequently are directional terms. And this figure outlines a lot of these directional terms. And again, start working on them now. They're going to come up time and time again on various exams. So the way that these work, they come in pairs. So if we were to use, here we have anterior and posterior. So anterior refers to towards the front, while posterior is towards the back. And the way that we utilize these terms is in comparing. So for instance, you can pick two body parts. The nose is anterior to the back of the head. Do you see how that worked? We were actually comparing the relative location of two body parts with this directional terminology. The back of the head is posterior to the nose. That just reversing the previous statement, but you get the same effect. So posterior and anterior is one set of these terms. We also have superior and inferior. Let's see where that is. Up here, superior and inferior. Superior means towards the top of the head, while inferior means towards the bottom of the foot. So in this case, we pick two body parts, and we can do the mentis, if you recall. The chin is inferior to the nose, so it is below the nose. It's closer to the bottom of the foot than the nose, while the nose is superior to the mentis. So there's another set of terms. Proximal and distal. These terms are used to describe the relative location of body parts within the limbs. So this is only within the limbs, so the arms and the legs. And proximal refers to being closer to the point of attachment. And here we have that little definition up here. Being closer to the point of attachment, while distal refers to being further from the point of attachment. If you consider the leg, the point of attachment is right here at the hip. And we can say that the knee is proximal to the ankle. That would be a proper statement. The knee is closer to the point of attachment than the ankle. The fingers are distal to the shoulder. They're further from the point of attachment than the shoulder. So there's another set of terms that are used, and again, only with respect to the limbs. Lateral and medial refer to a reference that identifies sort of the midline of the body. If you were to take the body and draw a line down between the eyes, between the breasts, all the way down, you would have a left and right side. Medial refers to being towards the midline, while lateral refers to being away from the midline. So in this case, the nose is medial to the eyes. So it's closer to the midline of the body than the eyes. The ears are lateral to the nose. They are further away from the midline to the nose. Superficial and deep are two others. Superficial means closer to the surface, while deep means further from the surface. The bone of the thigh is deep to the surrounding skeletal muscle. It is. You might not have an understanding of that yet. Perhaps the other example was better. The skin is superficial to the underlying structures. The skin is superficial. It's closer to the surface of the body than structures that are deeper. So these directional terms, again, they come up time and time again, so practice them and practice them well.